Hepatitis. It's a silent epidemic affecting millions worldwide, often without noticeable symptoms in the early stages. Hepatitis is inflammation of the liver, a vital organ responsible for filtering toxins, digesting food, and storing energy. This inflammation can be caused by several factors, the most common being a viral infection. Left untreated, hepatitis can lead to serious complications like liver damage, cirrhosis, liver failure, and even liver cancer. Early detection and treatment can prevent these complications and improve long-term health outcomes. By arming ourselves with knowledge, we can break down the stigma surrounding this often silent disease and take charge of our liver health. Now that we know what hepatitis is, let's break down the different types. The most common types are hepatitis A, B, C, D, and E, often referred to as the ABCs and Ds of hepatitis. Hepatitis A and E are typically spread through contaminated food and water, often in areas with poor sanitation. Hepatitis B and C are primarily transmitted through contact with infected blood and bodily fluids. Hepatitis D is a defective virus that can only infect people already infected with hepatitis B. Co-infection with hepatitis D and B can lead to more severe liver disease and a higher risk of complications. You might be thinking, hepatitis sounds serious, but I feel fine. Hepatitis can wreak havoc on your liver for years without causing noticeable symptoms. By the time symptoms like fatigue, jaundice, abdominal pain, and dark urine appear, significant liver damage may have already occurred. Testing is crucial. It's the key to detecting hepatitis early on when treatment is most effective. Early detection allows for timely initiation of antiviral medications, reducing the risk of cirrhosis, liver cancer, and liver failure. Testing is not just about protecting yourself, it's also about protecting others. Getting tested for hepatitis might seem daunting, but it's actually straightforward. Understanding the process can help ease your concerns and prepare you for what to expect. Your doctor will ask about your medical history, risk factors, and any symptoms you might be experiencing. This initial discussion is crucial as it helps the doctor determine the most appropriate tests for you. Based on this information, they will recommend specific blood tests to check for the presence of hepatitis viruses or antibodies. These tests are essential in identifying the type and stage of hepatitis. There are three main types of hepatitis tests: antigen tests, antibody tests, and PCR tests. Each test serves a unique purpose in diagnosing and understanding the infection. Antigen tests look for specific viral proteins in your blood, indicating an active infection. This helps in identifying if the virus is currently present in your body. Antibody tests detect the presence of antibodies produced by your immune system in response to a specific viral infection. These tests can show if you have been exposed to the virus in the past. PCR tests are highly sensitive and detect the genetic material of the hepatitis virus. This test is particularly useful for identifying the exact type of hepatitis and its viral load, which is crucial for treatment planning. Section 5. Are you at risk? Knowing when to get tested. While everyone should be aware of hepatitis and its risks, certain factors can increase your likelihood of contracting the virus. Hepatitis can be a silent threat, often showing no symptoms until significant damage has been done. If any of the following apply to you, talk to your doctor about getting tested for hepatitis. Early detection can make a significant difference in treatment outcomes. You have had a blood transfusion or received blood products before 1992. This is because blood screening for hepatitis C only became widespread after this time. You have liver disease or a family history of liver disease. Chronic liver conditions can make you more susceptible to hepatitis. You have ever injected drugs or shared needles. This is a high-risk activity for transmitting hepatitis. You have HIV or another sexually transmitted infection. Co-infections can complicate your health status. You are a healthcare worker or have frequent contact with blood or bodily fluids. Occupational exposure increases your risk. Understanding your risk factors is the first step towards protecting yourself and your loved ones from hepatitis. Regular testing and early intervention can help manage and mitigate the impact of the virus. Section 6. Beyond If your test results are positive, it means that you have been infected with a hepatitis virus. This can be concerning, but it's important to stay calm. Is needed. Section 7. Stay informed and seek medical advice. Navigating the world of hepatitis might seem overwhelming, but remember, you don't have to do it alone. Your doctor is your best ally in this journey, so don't hesitate to ask questions and seek clarification. Early detection and treatment are key to preventing serious complications and living a long, healthy life. Get informed, get tested, and take control of your liver health today. Section 8. Spread the word, not the virus. Hepatitis thrives in silence, but we can fight back with knowledge and awareness. Share this vital information with your friends, family, and communities. Together, we can break down the stigma surrounding hepatitis and encourage more people to get tested and seek treatment. Let's work together to create a world free from the shadow of viral hepatitis.